We're now going to turn to another aspect through which mobility intersects with other trends, here focusing on human mobility, climate change, and health. We're going to start with a position paper prepared by Rob McClellan and Chris Ebi, followed by Achilles, who's other discussant, and is Brenda? And then Brenda, thank you so much. And if you want to move yourself closer. Okay, okay. So with no more than that, Chris, would you like to start?
A second, and then I'll hand it to Robert.
And you may not need the mic if you're close enough to be heard.
My voice doesn't carry, I'll take this.
Okay.
I put this up because what you see is the cover of today's Science magazine. And there are a series of quite interesting stories that would have links to scientific papers about the impacts of heat. There's one focusing on how to make cities livable, focusing on India, where there have been thousands of deaths over the last couple of months from heat. So you might find this of interest, and that's why I put it up there. And Robert, you're going to talk about the paper.
Thank you and very briefly too, because I think everybody's had a chance to look at it. So I want to give more time to the discussants. So just a couple of thoughts. Chris and I worked together on the Intergovernmental Panel on Climate Change, the most recent Working Group 2 assessment report, which is on impacts, vulnerability, adaptation. We worked on a chapter that was dedicated to health, well-being, migration, displacement, and conflict. Here in Canada, it may seem unusual to sort of lump those things together, but actually in the United States, the funding agency for migration research and demographic research is also the funding agency for health research. So there is a logic to that. And we found through collaborating together, there are an awful lot of overlaps because to put it in, I think I'm quoting you, Chris, when we think about the bad things that are happening and are going to happen because of climate change, we can reduce a lot of them to impacts on our health and well-being. That's where, at the end of the day, whether it's wildfires or floods or rising sea levels or extreme heat, the way we individually pay the price is through our mental and physical well-being. So that's the genesis of this paper. It's something we've been thinking about. I won't go into it in too greater detail other than to say, I know Anna wanted us to think about the future of human mobility, and it may seem kind of unambitious to write a paper that says we need a typology, talk about academic. But at the same time, I think that is a good starting point for thinking about the future relationships between these processes, because we have good research on the impacts of climate change on health. We have good research on the impacts of climate change on migration and displacement. We've even got some data, right? So last year, 32 million people worldwide were displaced from their homes by weather-related disasters that are potentially going to be exacerbated by climate change. Most of those people will be able to go back to their homes. Many won't and will become migrants and displaced people as a result indefinitely. So we have data. And I don't want to get into, I truly do not want to open up one of those definitional questions. Well, what is a climate migrant? What is a climate refugee? Please, let's not go down that wormhole. That's been done to death for the last 25 years. I think we all know what we're talking about, even if we don't have a legal UN definition of it. And let's think about the future. And really, that's all I wanted to say. And I'm going to hand it back to you, Chris.
That's great. And I'll have one footnote to what you had to say. The reason that all of those issues were lumped together is because in the 6th assessment cycle, the co-chairs looked back at the 5th assessment cycle, and the Working Group 2 report was 30 chapters and didn't want to do that. So that's why they put a whole bunch of things together. I thought I'd take my time to talk about the shared socioeconomic pathways. I know there was questions about those yesterday. I don't have a presentation, but I can send you to a lot of resources if you'd like to hear or read more about them. Back in the late 90s, there was an effort under the Intergovernmental Panel on Climate Change, the IPCC, to develop scenarios for use in assessments. the scenarios have been used in climate change for more than 30 years because we're talking about the future. Everyone's got different visions of the future. If you're thinking about modeling, you want to have common inputs. Without common inputs, you can't make comparisons. You can't do a meta-analysis. You can't synthesize. That process led to the special report on emission scenarios. As of 7 years ago, the last time I checked, there was over 4 million citations to the special report on emission scenarios. So you could say it was pretty heavily used. The scenarios were developed in the late 90s. And as one of the people who was core to that liked to say, by 2005, there was 1 billion people in the scenarios whose parents never existed. Fertility rates had declined significantly after those scenarios were published. And there's lots of other ways that those scenarios were significantly out of date. It was decided for a bunch of very good reasons that going forward, the IPCC would not lead scenario development. It would be led by the scientific community, which leads to who is the scientific community and how does anybody decide what to do. And we're coming up to the 5th assessment cycle of the IPCC, and we desperately need to have new scenarios. And there was a series of workshops. Time was so short. What happened was there was a series of agreements between integrated assessment modelers who have large models of world economy and focus on mitigation, and the people who run the climate models on specific emission pathways. These are called the representative concentration pathways, the RCPs. So the decision was taken on the emission pathways. And it was an interesting negotiation between these two fundamental working groups in the IPCC. That working group 3 that works on mitigation walked in and said, we want to have 450, 550, 650 ppm CO2 in 2100 because those are policy relevant. The climate modelers went, yeah, we can't distinguish that in our models. So there was this back and forth of how they could set up some representative pathways that could be investigated. And so, and further, the science had significantly advanced. And so the representative concentration pathways look at the full basket of greenhouse gas emissions, not just a carbon dioxide. And therefore, they're in radiative forcing, they're in watts per meter squared. And so we've got the 4 RCPs, those are decided. The integrated assessment modelers work out the emissions that will achieve those. So you're given the answer, how do you get there? So they're given their answers, and 4 key teams then worked backwards to say, this is the emission pathway. And that was put in the climate models, and those results were then synthesized into the working group 1 contribution to the 5th assessment cycle. But it wasn't enough time for the people who do impact modeling to be able to really incorporate it. And so there was a separate process where we looked at how can we develop some visions of adaptation that, to the extent possible, do not include climate change, but we're just looking at different development pathways into the future because we know development matters. Anybody who works on scenarios tells you only do 4 because otherwise everybody picks the one in the middle. And what had happened with the special report on emission scenarios is there had been regression to the middle. They all sort of came down into one thing that was sort of in the middle. And it was a challenge because in climate change, we look at what's called the solution space. And our solution space was in here and not out here. So 5. And there was a process to develop narratives. From the narratives, then quantifications were developed for what could be quantified. Finally, the SSPs, the shared socioeconomic pathways, were published starting about 2007, I think. There's been 4,000 or 5,000 publications since those came out, slowly ramping up and now exponentially ramping up. The shared socioeconomic pathways are designed along 2 pathways, along 2 axes. One is a world with increasing challenges to adaptation, the other a world with increasing challenges to mitigation. because those are the two main solutions that sit in the climate change space. And then you put 5 boxes, shapes onto this space. You've got in the lower left, a world with low challenges to adaptation and mitigation. This is a world aiming to sustainable development. In the middle, you've got a world that just continues to muddle through, do some things right. They all take too long. We're continuing along our current trends. So that's SSP2 in the middle. Upper right is a world with high challenges to adaptation and mitigation. That's a world that breaks into large world regions. There's high level of conflict and high challenges to adaptation and mitigation. I'm not going to talk about the 2 off-axis ones because those were frankly really challenging to write. How do you write a world that has high degree of inequity, but can successfully mitigate? And it's challenging to write those. And so we spent more time on the off-axis ones than we did on the ones on the axes. And the intent from the beginning was then once you have the shared socioeconomic pathways, you've got your representative concentration pathways, that you bring these together into scenarios. So these were not scenarios in and of themselves, because as you start bringing in some of this information on the socioeconomics, you're going to start modifying what you're seeing in terms of emissions. And so there's now something called scenario MIP, where MIP is multi-model intercomparison program. And the scenario MIP has brought together and created some scenarios that are now also being exponentially used, both in impact modeling, but also in the climate modeling. The other point I wanted to make was as we were starting to work towards developing these narratives, we had one of our key meetings was in Washington, D.C., which happened to be during Snowmageddon, where D.C. got like that much snow and everything closed down for days. It was an event. And it was fascinating because the assumption had been prior to that meeting, based on the couple of decades of research that have been done in scenarios, that if you know the emission pathways, you know something about socioeconomic development. And at that meeting, the different modeling groups working on the 4 RCPs came in and they showed their demographic projections and they showed their GDP projections. And outside of the highest emissions, RCP 8.5, there was nothing to distinguish population or GDP across the others, that they were all the same. You put them on a graph and they just were all on top of each other, which everybody stood back and then went, oh, right, you can have a world with 10 billion people that everybody uses green technology and your emissions are really low. That people had just made the assumption that knowing emissions told you about development. In fact, it does not. It tells you a little bit, but not a lot. And so there was real effort in developing the narratives in the quantifications of making it clear that development is equally important. The most exciting thing for me as this was being developed is that the RCPs and SSPs can be used to answer questions that we could never answer before. I work in health, so you could imagine emissions staying constant. And we could now ask the question of how important is development? And we know intuitively the answer, but we didn't have ways to quantify that. So if we stay under RCP 4.5, how important is development to the number of cases of malaria? It's hugely important. But now those analyses can be done. And also then you can also say, what if we're in a world that continues to muddle through? What if we actually achieve the SDGs? What if we're in SSP1? How much difference does a little or a lot of climate change make? Again, we intuitively know the answer to that. And unfortunately, we're now seeing the answer to that with all the extreme events that we've had. But it's possible that now for the modelers to start tease apart the contributions of development and of climate change to a variety of projected impacts. And there's some pretty powerful papers that have come out on that. One's by Ed Byers at EASA that came out and was used in the special report on warming of 1.5 degrees. And it just shows this in circles of the number of people poor and vulnerable to climate change under a range of combinations, and showing how very, very important it is that we understand both. The SSPs have been energetically picked up by a range of sectors. Pretty quickly, the oceans group went off and created oceans SSPs that they're using to look at oceans management. The agriculture sector has representative cultural pathways that they developed that they're using in agriculture. Health has just not been really doing much at all on this. Ecosystems have picked it up. Every other year, more or less, except for COVID, we've been holding scenarios forum. And I'll never forget the first scenarios forum, an ecosystem researcher got up, was so excited about the SSPs because it told him about conservation in ways that he'd never seen anything before talk to him about conservation, and gave just a stunning and compelling presentation about how the SSPs would talk about tiger conservation, and had beautiful photographs of tigers. It was just an amazing presentation. One of those things that give me a million years, I would not have come up with tigers and the SSPs, but he did a fantastic job. So lots of people are taking this up. There's lots of literature out there. There is an explainer about the SSPs that came out in Carbon Brief several years ago. There is the International Committee on New Integrated Climate Change and Assessment Scenarios, ICONICS. If you look up ICONICS SSPs, it'll take you to the website. We have webinars every now and then. We've got explainers in our webinars. We talk about population projections. There was something last year talking about the new population projections that are coming up into the SSPs. We've got links to the scenarios forum, and you can see some of the work that's been presented. And we're going forward based on an IPCC expert workshop in April on thinking about how to update in certain dimensions, how to extend the SSPs in certain dimensions to add to the critical literature base that's going to be assessed in the AR7. Is that enough?
Of the SSPs. The only thing to add,
I think,
Do you want the mic?
yeah, the only thing I just want to add to
what Chris has very incredibly covered in a very brief period of time is actually that many governments around the world are also using the SSP RCP combinations to provide services. Environment and Climate Change Canada's Climate Services, which is a newer part of Environment and Climate Change Canada, but designed to provide climate information to any Canadian, anywhere from private sector to national Indigenous organizations to local communities, have access to Climate Services Canada. And that information is also derived from the SSP RCP combinations. So I think it's just to emphasize, it's not just a research application. It's really become a larger enterprise that now has these incredible local practical implications. So thank you for all that work.
Yeah, and if I could just underscore that as one looks at the projections, and I'll pick on the health sector, there's several dozen, 50 or more projections about heat-related mortality that only look at temperature. And frankly, those projections are not usable. We've got urbanization. How are we going to urbanize? How many people are going to be in the world? Aging populations. That the government focal points understand that these projections are not fit for purpose, that they need to understand the investments in climate change, the investments in urban infrastructure, the investments they need to make, and are looking for much more nuanced projections that can help them with their decision-making.
I think we're going to pass to Achilles. Just one thought for this audience is that within the SSPs, there are assumptions about future migration and fertility rates. And if anybody's really interested in this, let me know. There was a paper I published back in 2019 in Nature Climate Change, where I actually looked at the migration assumptions in these scenarios and suggested some adjustments. So if you're really keen on it, let me know. But otherwise, I'll pass to Achilles because I think he has some comments for us.
Sure. And Brenda, you want to go first or should I go first? Okay, excellent. All right. So thank you very much. And I really enjoyed seeing this typology and this idea of linking health with questions of migration and climate change. I realized that, you know, I don't know if it's a Canadian thing, but there was a lot of analogies. So I'm going to tell you the analogy that I use usually in these cases. And I explain to my students that climate migration is often kind of some sort of apocalypse sandwich, right? You have climate change, which creates a lot of fear for many people, and you have migration that for certain people also creates a lot of fear. You put it together, and then Robert and Christy gave us a little slice of health to put in the middle and to think of it. But I think it's very important to think this from the perspective of health. And while I was reading the paper, it really kind of opened up the complexity of this. I knew that this was complex. I knew that climate migration is complex. I knew that the idea of the climate migrant or the climate refugee is something that is very abstract and something that is discussed, if you want, in certain ways, but it's also something that we cannot really figure out easily, right? But I think looking at the health implications is important because it shows us not only what is happening in specific regions, right? But it shows us also the complexity of different sort of health risks associated with different events, right? Christy mentioned deaths from heat waves in India, right? And unfortunately, we don't have to go too much back in the past to find other extreme events that have created deaths. And this is just the tip of the iceberg. We're talking about displacement due to extreme events, right? We don't talk about slow onset climate change, droughts, and other things that are pushing people out of certain areas, right? So I think health can be the sort of prism that we try to understand this. I mean, everyone agrees that we want people in this world that are healthy, no matter how many people. You're going to find very few people that are going to say, no, we don't want healthy people around, right? I think the sort of implications for climate change and migration, it's something that is very difficult, actually. And the typology kind of brings an overview of how this can be done. What are the sort of areas that we can look into? So indirect implications of climate change for health, implications for healthcare systems and for their workers, implications for health system financing. And if you think about this, we're just looking at the health sector. Christy mentioned urbanization earlier on, right? This is a very important part of the climate migration story. A lot of the migration is actually that we have seen so far, and a lot of what is predicted is internal migration, right? And I think the fact that you have all this complexity brings also opportunity to think about the sort of challenges, not from the strictly migration perspective, right? So this is not a migration challenge where we need to think whether we have to, or not solely a migration challenge where we need to think whether we have to revise the Geneva Convention, whether those on the move are migrants, refugees, IDPs, or internally displaced populations, but to think of it from the perspective also of how urbanization is occurring, what are the sorts of conditions that people are finding, what are the sorts of conditions that people are escaping, and what is the level of choice that people have in terms of moving, right? Typically, we think of restricted choices when you have international movements, right? Because of the policy or the institutional context. But a lot of the times, some of the restrictions that we see with climate migration have to do with the resources that people have. Are people able to actually move from a rural area that is hit? Are people, I remember in the paper you mentioned, or in the British Medical Journal a newsletter, you mentioned something on East Africa and the fact that many people go hungry, right? So the question is, do these people have the choice? And how do we think about this health systems, not only from the perspective of the migrant, but also from the perspective of those who are immobile, whether they decide to be mobile, whether they decide that I have strong links with this specific place, I want to stay in this place, or whether they're forced to be mobile, meaning that even if they wanted to go somewhere, they cannot go somewhere. I want to finally draw attention to a couple of things that I think are interesting, and I'm going to ask a couple of questions also for Christine and Robert. First of all, there's a lot of mention about the sort of solutions, and I think a lot of the solutions that are presented, such as relocations, are becoming issues that are not only technical but very political. Right, I work a lot in African cities, looking at climate migration and what I call the destination areas, informal settlements. When we did some surveys in 4 different cities a couple of years ago, what we found is the sort of compounding displacement risks. So people would tell you, yes, when it floods, the settlement, I have to leave or I have to move somewhere, but also there's a fear that the government is going to evict me because I'm squatting this land and I'm not supposed to be in this land, right? So addressing the health perspective, which is also a big part of the story, at times of flooding, you get cholera outbreaks that happen in some of these settlements. It requires us to think this perspective holistically. I do think that health could be, again, the right prism. So my question is, how do we do this? I mean, we saw with COVID-19 was probably the perfect kind of rehearsal to what happens in a case of a global emergency. And you know, I mean, we can argue that we didn't do so well. Right? So what are the sort of kind of systems that need to be put in place to think about the whole perspective, not only from the local level, because you have a lot of inequities, but also globally? You know, is WHO the organization who's going to have to coordinate kind of the sort of responses, right? And then my second question that goes more to the migration part of the story is, and again, drawing from COVID, we heard in India, for instance, that there was a massive exodus from cities, people going back to rural areas, basically to get welfare, because welfare was tied to the place of origin, right? So should we start thinking about kind of, let's say, mobile health rights? Should we start thinking about ways to provide and to make sure that healthcare is there for those who are going to be mobile, if we know that the world is going to become more mobile due to these movements? So I'm going to stop here and let Brenda.
Thank you. And I'm sure there are lots of questions, so I'll keep my comments short. So my main takeaway from the written paper is the focus on the interlinkages between systems. I mean, it's a very simple point, but climate system, migration system, and health system are complexly interlinked. For me, these interlinkages span space. So they link countries that are poor and rich. There are linkages between hazard-prone areas and relatively safe zones. They link resource-producing regions and high-consumption nodes. So I guess adding to the fray, I think that developing a typology such as the endeavor in this paper needs to also look at spatial connections and spatial variability. So that's my first point, I guess. Not much of a point, but I have to start somewhere. So the second point is that these interlinkages also have a temporal dimension. So the linkages between the 3 systems that are at the heart of the paper also stretch back to link systems of exploitation, extraction, and access of the past, and that's linked to the current system of inequality and instability. And to what extent does this, in a sense, cripple the future with the weight of the past and present carelessness, I guess, is what comes to mind. So those are just 2 very simplistic observations, but I do have 3 more concrete questions. One is that, could you say a bit more about I guess it's like Achilles' question, are the first steps towards improving systemic resilience of interlinked systems? I mean, if there's so much complexity, how does developing a typology provide that first step towards understanding, say, what are the thresholds, what tipping points in these interlinked systems? I mean, some clarity on that, I think, will be very helpful to me. My second question has to do with just migrant healthcare workers. So what implications are there for the production of migrant healthcare workers, for implications for countries that produce these healthcare workers for the global market, like the Philippines, and countries which have huge care deficits and rely on migrants to plug these gaps. So is that something that we should, in a sense, also consider? And my third and last question is linked to what Achilles have already mentioned. I mean, expanding universal health coverage is something that's central to the SDGs. So where do migrants stand in this chain of events? Who should pay for the healthcare for climate displaced migrants? Is there a place for mobile healthcare rights that Achilles already mentioned? So, I mean, yeah, so those are like thorny questions that I gained from the paper, but couldn't see through the glass darkly. Yeah.
Thank you so much. Robert,
But in the context of, yes, I think I've always been fascinated by tipping points and thresholds. And so, yeah, if I personally were to work in this area for an extended period of time, I'd want to see where those tipping points and thresholds are. And I know, Chris, you've worked on this a lot with burning embers, and maybe I'll give you a chance on that. And the other thing is, I think that that's why I think I wanted to start with the typology to render explicit stuff that we implicitly understand is interconnected in a complex fashion. And so I'll just leave it at that. Chris, do you want to go from there?
Can you hear me well enough from this thing, or should I use the mic?
It's okay.
It's okay? That's okay, that sounds great. Excellent questions, difficult to answer. And I've got two suggestions at different scales. The first really is focused on funders, in that the funders need to understand how critical it is to fund these systems-based questions, and that these systems-based questions cross disciplines. It's not systems-based questions within a discipline, it's across many disciplines. And there is some progress in that space. Certainly the EU is really moving forward on looking at systems-based issues, and the extent to which the funders can really be moved in that direction here. We've got a little bit of progress in the US, not a lot, but it's the only way we're going to start understanding. And as part of that, I'm a big proponent of modeling. Models are simplifications of the world. We know that. They can never be as complex as the world. And yet models can provide critical insights. From my perspective, it's important to think about modeling for insights. You're not modeling for the number of people who are going to be affected. You're modeling for insights in how the systems interact. And that's what the modeling has done on the climate side of looking at the tipping points, because they're looking at a variety of interactions. And the models are a way to start those insights, which then you can add your own expertise to and provide some critical perspectives that'll be useful for policymaking. The second is something that's called stress testing or wargaming, and it's a much more local scale kind of activity. And this is thinking about events outside of recent history, and thinking about the stakeholders you would want at the table to discuss an event. Peter Barry at Health Canada and I and several others put together a paper on stress testing in health. Peter followed up with funding of 11 or 12 groups in Canada that have been doing some stress testing. At the very, very beginning of COVID, Canada had a national adaptation meeting held in Vancouver. So I just took the bus up from Seattle. Peter had set up a session, had to be moved to a larger room. He had his staff develop 3 2-page stress tests. And I'm making these up off the top of my head because I don't remember. So it's June 19th, 2032 in Regina. And there's some big extreme event. And it describes what the city could look like in 2032, a little bit about the urbanization, a bit about the population growth, a bit about the changes that could occur by 2032. And then the point of the stress test is talk about how are you going to manage this. You've given them an event that's so extreme, the answer is they're not going to manage it. And so that's not really the point. The point is, what can you start doing today to be prepared? And this kind of process is used extensively by the military in all high-income countries. I was involved in a war game about climate change in, I think, 2007. The premise of the war game was, when you come into a war game, they give you instructions and then it's whatever date it is. And so the war game was set for 2015. It was set up to discuss primarily adaptation, although we spoke about mitigation. And it had 4 major events that had occurred. There was a lot of, the work in a stress test is developing the stress test. It is really, frankly, a lot of work. The 4 events, it brought together the 4 major emitters, the US, Europe, India, and China. For the life of me, I do not remember the event in India. The event in the US was a Category 5 hurricane hit Miami. This is, of course, before Katrina. The event in India was 200,000 Bangladeshis trying to get into India because of significant flooding from the Ganges. And then the event in Europe was a couple 100,000 Africans trying to get into Europe because of drought in the Sahel. This was in 2007. And so some of the issues that you raised came up in the discussions of thinking about how to handle healthcare. And there was lots of discussions during this wargaming exercise about how do you think about healthcare and what could one do as a crisis situation unfolds. I don't think it really informed actually what Europe did, but we did have discussions during the stress test. And thinking about the internally displaced people of, look at what happened with Katrina, of so many people moving to other communities, and how do the receiving communities then manage healthcare? How do they manage getting kids in school? What do you do when the person says, I've got a disease, I'm not entirely sure of the diagnosis, but I take a pink pill every day, and you have no access to medical records? There's all kinds of challenges that have to be faced. And the point of the stress testing is to have all of the responsible parties, all of the trusted voices talking about these kinds of situations and working through, in fact, what do you need to start thinking about today so that if something like this happened, you'd never have the exact same event, but if something happened, that you at least have started down the road of preparedness and you have thought through the kinds of connections you're going to need to make, and you can start establishing the lines of authorities that would be needed to manage a situation.
I'd like to open the room for questions, comments. Yes, start with Igor, and I'll just keep an eye for hands raised.
Yeah, behind you or
Yeah, I was gonna say, but I will also look for eyebrows raised. I'll take any
Opportunity to keep these conversations going. Thank you, Igor.
Okay. Well, first of all, I have a huge admiration for scenario planning and this kind of exercises. And as a fellow person who is interested in forecasting and foresight, I'm really excited about what you talked about. As a decision-making scientist and as a psychologist, I have questions about the decision-making processes that go in the heads of the people who engage in scenario planning. One of them is, well, you obviously have some kind of priors, some kind of assumptions, and how do you mitigate biases? We talked about biases for so long, the prior section. How do you mitigate biases that people bring to the table? How do you increase accountability? My understanding is that scenario planning is not very fond of putting actual probabilities on the table. So like, we create, these are future scenarios we need to consider. Yeah, Chris, you mentioned that multiple times. But then the end of the day, we don't make predictions. We don't make concrete predictions. No. But why not? Why can't we, for instance, put some probabilities when groups get together and, for instance, during stress testing, include some priors about which of the scenarios, according to the group, were more likely and less likely, and then test them. And that leads me to another point that is kind of actually deeper. So Phil Tetlock and Phil and I have been working for a number of years on evaluating social scientists' abilities to predict things. And according to Phil, we are not very good, whether in political science or in psychology, according to some of my work. And one project is specifically on predicting human welfare and where our societies are heading now. And we tried to look at data, quantifiable data, to evaluate that, where people make some predictions and then you try to evaluate, are they right or are they wrong? Short-term predictions, so we can't really make people make predictions for 20 years from now, but we will not be waiting 20 years to get that response. It was really hard to get any good information. So you mentioned, for instance, both of you mentioned health and mental health. I know for the fact that the meaning of mental health, Andrew is sitting here, he spent his career talking about how the meaning of mental health may take different shapes in different cultures, but even just like measuring mental health around the world in a systematic fashion is a Sisyphean type of work, where it's almost impossible. And even for normal health markers, infant mortality data, we do have a decent resolution. Many other things that you would think we would have, including things that would be very, very pressing, I bet there is not good enough data, or there is no representative data. And the data that exists would be spotty approximations, including some guesstimates from people at World Bank or at the UN that would sort of like estimate what would be for that country in that year, but actually they collect the data from that country only every 5 to 10 years. And that leads me back to the question about the people who get back to the table when making scenarios, when creating those scenarios, because surely they come with some kind of prior beliefs, and surely they base it on the data that is available right now. But what is the data that we're then using if there is no data available in the first place, or it becomes available only with 5 to 10 years delay? So that's my question.
Thank you. I guess as you were describing the scenario planning and the scenarios of the different regions and the disaster scenarios of the different regions, what occurred to me is, how realistic they were in many cases, right? They basically happened. Yet the actual policy response fell completely flat in almost all of those cases, right? It was a political nightmare. So I guess maybe my question has an obvious answer, but where's this huge disconnect between all of the resources, time, planning, effort, scientific expertise going into all of this scenario planning and what actually happens when these things land and happen? So.
Thank you so much for this very amazing presentation, and also for summarizing SSP story and narrative in 5 minutes. My question is more related to the population projection and in particular to the characteristic of population, because making the point related to adaptation and mitigation. So how we can, which is the role, in your opinion, played by education? We discussed a lot regarding the cultural constraint and the determinant of population behavior. Do you think this is an important factor? Thank you.
And it took Chris and Rob was in reflection.
This is a test for how much we can remember. So I'll do it backwards. On education, yes, education's critically important. And Wolfgang Lutz has been the premier modeler of demographic change, in part because he had the insight to put education into his projections. And it's education specifically of women, that his projections diverged significantly from the UN population estimates because they didn't include it. So yes, education. On the question about the stress testing and it being taken up by policymakers, two responses. The first is wargaming is done literally all the time by the military, and they use it. The stress testing isn't yet something that policymakers are really focusing on. And it's something I think the research community can really help them understand why they should be. The other part of that response is we don't have the counterfactual. And that's always a problem. There was a massive heat wave last summer well, not this, just immediate last summer, the summer before in London. The numbers are going to come out later in the fall, but they still had significant mortality, despite having a well-designed, well-run, long-running heat wave early warning system. But we don't know what the number would have been without it. And that's a persistent challenge in public health of how do you show that something was effective, because you don't have that. So try to keep in mind the counterfactual probably would have been a whole lot worse. We know that the 2003 heat wave in Europe killed about 70,000 people. So the counterfactual is quite significant. On the series of questions from Igor, let's see if I can remember all of those. In terms of biases, I'll speak specifically for the SSPs, is that we started with this framework. So we spent a lot of meetings, including government focal points and others, talking about the framework of these two axes of challenges to adaptation and mitigation. And so started from the framework. And then there is high awareness that we all bring our own perspectives in. There was an effort by the US State Department to have pretty thorough review of these before we even posted them online, where we asked for community review. They then went through essentially 2 rounds of peer review, because the first round was for the journal Climatic Change, very extensive peer review for the framework. And then the results, the final narratives and the quantifications were published in Global Environmental Change, and extensive peer review for both places. So as much review as you can get by the community of making sure that these did not had few implicit biases. So really made an effort to make sure that the community was engaged. You can argue there could have been more engagement, and absolutely there could have been. The effort with the State Department was try to get more review from low and middle income countries, and that essentially failed. I reached out to 50 researchers in low and middle income countries and had a really hard time getting anybody to do a review of this, but certainly more could have been done. In terms of looking into the future, my favorite story is when Thomas Watson ran IBM. The first personal computer was developed and was presented to Thomas Watson, head of this major multinational corporation. And he reportedly opined that the worldwide market for PCs was 10, right? So we've got twice the world's market in this room. Humans are just terrible at looking into the future. And that is why you have to use scenarios, because people on their own can't imagine a different future. Some people can. Futurists spend their lives trying to do this, but the average person, even the average scientist, I spend my life in meetings where people start talking about something and they're implicitly assuming everything's going to stay the same, only their area of interest is going to change. It's like, that's not going to go. That's the least likely outcome. And so finding ways to get past that is incredibly challenging. In terms of putting probabilities, one of the SSPs really focuses on this high degree of conflict. World breaks into large world regions. And we wrote this not long after the Paris Agreement. Nobody thought we'd be in a world where Make America Great Again, where we've got authoritarian leaders rising in so many parts of the world. We've got a whole series of coups going on across Africa. It was just not imaginable at that time, which is why you need to have these really broad solution spaces, because we don't know what the future probabilities could be. And all of the scenarios are based on priors, so they're Bayesian. I'm going to assume X, and when I assume X, then. And so it is possible for groups to take those and try to put some probabilities on them. But then you come back to the implicit biases. This is a large group of scientists putting the scenarios together, and we just really didn't think we'd be where we are today, even though we're working on scenarios and trying to imagine different socioeconomic futures.
I don't have a whole lot more to add to that, other than I suppose, yeah, I don't think we ever should let data availability determine what we do. Otherwise, we'll never do anything, right? I mean, we get into, was it a Jacques Derrida kind of world where you can't know anything, so why bother? Except I'll still keep my tenured position and draw my salary telling you can't know anything, so why bother? But you pointed out Andrew there, you called him out about, mental health being, contextual, being, in the case of Canada, under-resourced and poorly understood in terms of what's needed and what so on. But that doesn't mean you exclude it, therefore, from the scenario, because, well, we don't really know what's going on with mental health, so we'll leave it out. Actually, it's the inverse. You say, we are going to need more information about mental health. For the time being, let's block part of the scenario and saying there will be more demands on existing mental health care resources, likely additional ones needed as well, and at least it's in there. And then hopefully you can backfill with data later. The final thing I say to policymakers, especially thinking of that link for migrants. I mean, the reality is that migrants are often amongst the most vulnerable people in our communities, regardless of why they moved, regardless of when they move, regardless of how they move. They often face additional challenges to the resident population. And those who have experienced harm because of climate change, there are going to be people who have healthcare needs associated with the harm they associated with climate change, but also the additional challenges faced by being a migrant in a changing climate. So you get these sort of, what is it, double exposure, triple exposure of risk, compounding. That's what you said, compounding. Achilles picked it out earlier. So two messages I give to policymakers. One is, well, achieving the SDGs would actually make a lot of these problems go away. So you already have a plan, so follow that one and you'll probably solve a lot of these climate and health related ones. And the second one is essentially, if in doubt, be compassionate. But that's not how governments think these days. Anyway, I should give this back. Did you want to comment? Some ideas on any of these, or?
So I see a number of hands going up. Achilles, you're holding the mic.
Yeah, I'm gonna comment over lunch.
And again, if you have questions online, I'm assuming you're gonna do a round of online.
So there is one question from our online participants. Chris has said one popular trend in scenario planning relates to the environment, and that is backcasting. Backcasting is different than scenario planning because you start from a future you want and then work backwards to think about the interventions required to achieve that. Do any of the panelists or discussants have experience or thoughts about real or potential use of backcasting instead of forecasting for climate change or mobility? That was the only one so far.
With the Western Pacific Regional Office of the World Health Organization, that's been interested in exactly this, of identifying several ideal idealish futures and then seeing what needs to be done to achieve them. It's the same that's being done for the SDGs. If we're going to achieve the SDGs, we have to do a range of things. And it is, sometimes it's a much easier entry point for discussion when there is already a notion of what that ideal future would look like. Yeah.
And just to pick up on that, historical analogs, right? There are cases where people, well, a lot of what I know about drought and migration is from studying the 1930s Dust Bowl migrations here in North America. Actually, you find that the circumstances are pretty similar to what we see in dryland parts of the world right now, or what we learned from Hurricane Katrina, essentially just how badly unprepared we are for large disasters and so on. So there's lots of benefit, and that's not necessarily a backcasting exercise, although it could certainly be done in such a way. But learning from the past, I've heard it in other sessions as well.
Thank you. And I thought, let's start here, and then I'll do sort of another sweep of the room.
Yeah, thank you so much. I find the whole idea of scenario building, finding that solution space, like very interesting. And I don't know if this is relevant, what I want to say, but it's in my head. So I guess at some level it is relevant. There are so many issues we all know as social scientists that there's a lot of data about. And is there scenario building related to so many social problems that we call like wicked problems? And we all know why many of these systems are failing, because there is lack of coordination, lack of collaboration. So some of those very real issues, like we know that for mental health, there's so much intersection between poverty, gender, homelessness, vulnerabilities of all kinds, including coming from migration. So we know it's all there. So is there any solution space and scenario building that might be happening to actually tackle these issues regarding which we know what the issues even are? And we don't need predictive scenarios at all. Thank you.
Yeah, I just wanted to reflect on the example on 2007. On 2006, there were 49,000 people who moved mostly from Mauritania to Canary Islands. So there's a clear that is why there was that scenario. And this 200,000 people scenario is not, it certainly has not been too far from the reality for the next 10 years. So the question then arises that I think some people have commented, what was the outcome of that consultation? What systems did they put in place? And my next question is, do we see any role in technology in fundamentally changing those scenarios? I, for one, as a qualitative scientist, I'm very skeptical of the scenarios because, as you just rightly said, you have to try and assume everything else stays the same and two things vary. But not only many things vary, but also humans vary in the way they take their decisions. So I wonder whether, and one thing that we're trying to do in this effort of open thinking is, and I think, Alka, you mentioned that yesterday, instead of try to create resilience to possible disasters, think rather positively. So how do we want the future to be? So how do we want to plan this? How do we want to govern, for instance, migration or climate change or health for that matter? So just some reflection.
Add one very quick thing. I've done some work. My migration work is kind of located in the peace and conflict studies area as well. So we have this big theory of imagining cultures of peace. And is that going to be a panacea? Because it's not enough to imagine those when we already know what are the concrete roadblocks. And I just wanted to mention it because it relates back to the question I already asked before.
Thank you.
Clarify that the scenarios have multiple factors changing. So the scenarios do look at many things changing. I was
characterizing how some of the projections are done, and that I've sat in rooms, particularly around the global health security agenda, where the implicit assumption is nothing's going to change except an emerging pathogen. And that is the least likely outcome. And so questioning these implicit assumptions that the world somehow is going to stay exactly the same as today, we just have to get past this. And then quickly on sort of the uptake again, there has to be more interactions with policymakers. And saying that we know something doesn't mean that policymakers know it. And I think of COVID, where everybody in this room knew our health systems were not in the shape they needed to be. Every person in a high income country knows their health system's not where it needs to be. And that is a fundamental shift because of COVID. And so the communication aspect's critically important to get people to understand what we already know so that appropriate action can be taken.
Okay, thank you. I'm now going to turn it to Andrew.
Is it working? Okay, there we go. Since I was called out as it was put, I'll say just quickly about culture and mental health. I mean, I think on the sort of negative challenge, everything's so incredibly complicated end of things, you could take the sort of subtleties of the cultural shaping of mental health and expand it to all the other things we've been talking about as well. People in different parts of the world have different moral priorities. They're convinced by different arguments. They make decisions in different ways and so on. And yet we're at the same time trying to come up with a global strategy. On the other hand, on a more optimistic note, I don't think including mental health in models requires getting into the detailed anthropological weeds of exactly the understanding that is present in one particular group in one particular region, but rather to look at broad impacts of mental health. So on the one hand, even in Western societies, we have an awful time defining psychopathology, let alone figuring out how to intervene in it. DSM, for those of you, the psychiatric Bible, quote unquote, is a complete disaster. On the other hand, we do have broad understandings of the different ways in which mental health ends up making a difference. It's a bit like in physical health, you know that mortality rates, you don't want them to be too high. Then you can have a different conversation about what was causing it, and an even different conversation of what the people made of that condition. I think you can do the same with mental health and look at lost time, lost years to disability. There's different indices that the World Health Organization has come up with to give a kind of broad sense of mental health impacts. And since I'm holding the microphone, I'll just repeat my plea from yesterday. And be interested to hear anyone's thoughts here about ways in which just like in cultural psychology, we want to bring the social context into our study of the individual, which is what has been, to me, has been so stimulating about this discussion, because these are things that psychologists don't talk about enough, but also to flip it and make a plea for the inclusion of culturally and socially sensitive psychology and other disciplines that focus more on the individual level to really work together to think of integrative ways that we can do both. Because on the one hand, it's a global problem. On the other hand, we're making appeals to individual people to make different political decisions or to act differently or to imagine different futures.
Is maybe something that we could also open up at this time. I think one of the goals was, really just to get us started in these, sort of not even quite 2 days of sessions, but we may perhaps, sort of as we're talking about all these projections, ideas about the future, this may be a nice way to start to bring together a lot of the themes, sort of thinking about the parallels, for example, to like the boundless imaginaries of AI. And I think Anna's call to perhaps ground that more in some ways, but could scenarios help us as well in getting a better hold of something that seems sort of either quite distant or quite, but only something that very technical people can explain with very good analogies. Or are there other things that that we could do in order to bring together the types of knowledge that may seem quite disparate, but through use of scenarios or scenario-like tools, we might be able to better communicate with each other how things link up. So maybe with that, if that catches anyone's imagination, or if Anna, you'd like to build or offer some of your own comments and thoughts.
Yeah, thank you for the provocation, the first provocation. No, what I yeah, I think I share Chris's and Robert's concern that we probably think we're thinking the future, but we remain very much anchored in what we know. Again, from future, so with Ibrahim and some others, we have been also trying to carry this discussion further, and hopefully we will, and you'll hear from us. But for instance, how can we use, for instance, the arts to kind of, and I'm not thinking now science fiction, an alien from the moon or some apocalyptic scenario, the whole world is flooded, what happens? But and I'm not even sure what I have in mind, but I still remember another colleague was saying, the future studies, people would say, okay, what would be a headline from 2060? What would a headline on 2060 say on migration? So some such kind of thinking that is not apocalyptic, because I think if we look, for instance, again in the arts, in the cinema, we usually had all the apocalyptic movies and actually exploring how humans would react. And I still remember, I can't remember the name of the movie, this movie where supposedly a meteorite is about to hit the world, and some people have been selected to go into this modern day type of Noah's Ark because of their variety. You've seen this movie, their variety of characteristics, but of course all they have to be healthy. And the movie starts with these two families having a barbecue, and the TV is interrupted, and a message is broadcasting which says, Brenda, take your spouse and children and go to the place and suddenly the other friends say, anyhow, they realize this is something like some apocalypse coming, and I say, Brenda, take my child. I don't care about me, and Brenda says, no, I can't, because this is only for those. Anyhow, no, I'm just to make the narration easier, because and then it shows all sorts of human reactions in the process where these people try to get there, whether they take the grandpa or not, whether they take the child, and they get there and their child has child diabetes, and they tell them, no, you guys can go, the parents, but he's out. And eventually, anyhow, there is sort of a happy ending. And imagine, actually, the place is somewhere north of Canada. The place where they're all going to hide from the meteorite is somewhere north of Canada. So, and all this is happening in the United States. Surprise, surprise. But so this is just to say, not this kind of apocalyptic scenario, which are still interesting, because really that movie was about how humans react. What compassion, or taking decisions, non-compassion. The grandpa saying, I don't care, leave me here, I've lived my life, I don't want to come. And solidarity. Someone was raising the question of solidarity, but my reflection is, beyond this, what ways can we use, for instance, the arts, painting, drawing, digital storytelling, to think about these alternative futures and complement the work that is done through scenarios, or for us, at least, I think both social and positive scientists together to say, again, yeah, what would be the headline of the future? What is something new that we can think of more than resilience thinking, okay, if this terrible thing or this new challenge happens, this is what I'm going to do. So this is my reflection.
Information on social networks, and when you think about health and migration and climate change, that's recipe for misinformation. And I want to hear your thoughts about, and I hear your comments. There's a lot of uncertainty with regards to also what we know, and that could also play into how misinformation is created. And I just wanted to hear your thoughts about how these simulation models, predicting the future, etc., scenarios could actually help with maybe addressing some of the misinformation.
Can I take that one? My old PhD supervisor, I shouldn't say old, he's older than me, but he's retired now. He used to say, climate scientists and the social scientists who work on climate change impacts have more data and understanding of the interactions than does the Bank of Canada about the economy 6 months from now. And yet every nitwit politician will listen to the finance minister's random predictions about what the economy will be like 6, 12, 18 months into the future. They have no idea. It's 50-50, right? Any financial analyst can tell you why the stock market did what it did yesterday. None of them can tell you with better than 50-50 prediction power what it will do tomorrow. And yet, we worry about the uncertainties and not on the certainties, which is if we keep cranking up fossil fuels in the atmosphere the way we are, things are going to get much, 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 much worse at a nonlinear rate. The window to avoid that future is still open, but it closes with each passing day. So I think and that's another message I give to policymakers, which is we can continue to do nothing. We may not have perfect solutions now. We don't have airplanes that run on non-fossil fuels, but we're getting close. But in the meantime, we can change a lot of stuff. We don't have to wait for the perfect solution. So I guess that's coming back to let's not let the uncertainties get in the way of the certainties, which I think are still much greater.
Thank you. Chris, and I saw Achilles, and maybe Brenda, if you have some comments as well, and then we'll go back to the room.
There's quite a lot of media training, particularly going on with the climatologists on doing exactly that. It's part of their culture that they start talking about the uncertainties first, and changing that's really important. To the comment to the person behind me that I can't see, I don't have eyes in the back of my head, no matter what my kids think. The real challenge I see with the misinformation is scientists are tied to evidence, and the misinformation has nothing to do with evidence. And so I was demanded a couple of weeks ago to join a debate with a skeptic, but they're evidence free, and you can't do that when we are tied to the reality of the data of what we know, what we've projected. And so there's other answers other than providing better information to counter misinformation and to get people to understand that perhaps conspiracy videos are not a useful way to spend your time. I was recently in a taxi and somebody was quite hesitant to talk with me about something and eventually raised it, which was this person really liked conspiracy videos and asked if it was true that there's a secret location in Alaska that controls all of our weather.
So I have to say that the reason is where Anna was saying earlier, right? I think on the one hand, it's very important to say, okay, I don't know what the future is going to bring, but it's happening now. Like last summer, I had to evacuate for the first time because of fires in Greece, right? And I spent my life, seeing fires from afar. But it was the first time that you're like, okay, this is really getting real. I can see it happening and it's affecting me. And I think that's kind of the message, that it's not about futurology. It's not about in climate migration, everyone tries to predict the numbers and everyone has a methodology. The numbers are all over the place. People grab the numbers, whether it's the far right now that says, oh, there's climate refugees coming. Did you see the numbers that were projected? So I think that it's important to say that, okay, this is an issue that is happening already. This is an issue that has been happening already. These are problems that we know that were there and have been there for a long time, that we know how to deal with because we have dealt with them. And I think there's also a big question about what is the sort of narrative that comes out. Because if the narrative is that if we don't act now, then what's going to happen, it's going to be a very different response. And also in terms of migration, what is the sort of narratives that we are bringing? We're talking a little bit about this yesterday, but is the idea of the migrant, someone who is a risk to the country, who's coming in to, burden health systems and all that? Or is the idea that this is, someone exactly like, my grandfather who immigrated and has this kind of sort of positive narrative that we give about past generations of migration? And I think it goes back to Robert's point about, in the end, empathy. Can we create narratives that push towards empathy in an environment where you can spend your day in Facebook and become crazy about a group that or have an opinion about an issue that you don't have an idea of? So I think that's just rambling now, but it's the end of the day.
And yes, please. Thank you.
So we're in the space of like wondering about the future of humanity. I mean, I just want to throw in the fact, I think that in a sense, Robert has already mentioned that we also should learn from the past. I mean, it's not just the future, but in migration, there's so many things that's happened in the past that keeps repeating itself, and we don't seem to want to learn from that. I guess the sad story is that we don't want to learn what we don't want to learn. So, I mean, and perhaps, I mean, the past would be a good compliment, because the past is also, as they say, a foreign country. I mean, that in a sense also needs to be looked at and examined for its value.
Thank you, Brenda. We are now at 1:30, which is sort of the hard stop on this meeting. Many of us, including many of the people who are joining us from different time zones. But Brenda, I could not, I mean, that was such a wonderful closing comment, and thank you for that. Anna, if you have any sort of final thoughts or outcomes or things you'd like to share.
Well, thank you, Elizabeth, first of all. And thanks to all the chairs, the co-chairs for the online, and the note takers, and of course the speakers and commentators, and everyone who endured this conversation for 1.5 days. I believe that unlike usual workshops where we have a paper, we discuss the findings or the methodology and go back home, this was a very much open-ended conversation, but I think I have great notes and really some insights that are different from the insights to which I came to this yesterday mornings, and I hope that this is true for many of you. Again, I want to thank everyone.